everyone. Thank you for joining in with us. We're going to be getting started very shortly here. We're going to give people a few more minutes to join in. So hang tight and we'll be back in just a minute. Alrighty. Good afternoon, everyone, and welcome. My name is Kyle. I am a physical therapist and clinical director here at Spear Physical and Occupational Therapy. I want to welcome back those of you who have attended one of our webinars before, as well as those of you who are joining us for the first time. So thank you all for spending the next next hour or so with us. We hope you learned something and have a little fun with us. For those of you who don't know who we are, Spear is a private outpatient practice that's been around for over 20 years, and we have 20 locations located all over the New York City metro area. We've continued to offer in-person care through the COVID-19 pandemic, and we're going above and beyond the CDC protocols and guidelines to ensure the safety and well-being of everyone in our clinics. For more details on those measures, please visit our website at spearcenter.com. We've also launched Spear Live Spear Live for those of you who are looking to receive care from the comfort of your own home. This gives us the opportunity to deliver physical and occupational therapy treatment through our telehealth portal online. Again, please visit our website if you have any questions on that. All right. So we're here whatever makes you feel comfortable with us, either in person or on Spear Live. We're happy to provide the same care to you regardless. So please reach out to us. We'll give you some information towards the end with our contact info. So we're here today because through the COVID-19 pandemic, we've noticed a lot of people reaching out to us with complaints of shoulder, elbow, wrist, and hand pain from things like working out at home, sitting for long periods of time, not getting your normal workout in, sitting at the computer for longer than we have. So our clinicians got together and we agreed that given today's circumstances, it would be a great idea to provide you all with some tips on how to both prevent and address any of those injuries or symptoms that you may be feeling. So we created today's talk specifically for you, and we're coming live from the comfort of our own homes and offices. We don't anticipate any technical issues today, but if there is, please bear with us and we'll work to get those navigated as soon as we can. As part of our session today, we'll be demonstrating some exercises. We look forward to you guys joining along and participating at home. This will definitely not be like your other Zoom meetings that you were on today. We're going to have some fun and get up and move a little bit. Please note that if you're experiencing any pain while performing any of these exercises that we demonstrate, to stop and reach out to us directly so that we can support you through those. Throughout the webinar, we want to hear from you. Please, if you have any questions, feel free to use the Q&A feature at the bottom of the screen to ask us questions. We'll leave some time at the end to be able to answer as many as we can. Please make sure to use the Q&A option, not the chat option. That's where we'll be checking. For those of you who are joining us on YouTube Live, we'll be monitoring the comments section on there as well. So for YouTube, please use the comments. For Zoom, please use the Q&A feature. And we'll be checking on those periodically to get to some questions at the end. All right, so let's go through our goals for today and some of the topics we'll be covering here. So the first thing we're gonna do is we're gonna identify some of the pain that you guys have been coming to us with and the causes of them and how we can work towards that. We're gonna learn how to alleviate the pain and prevent it from progressing. We're gonna use some household items for some therapeutic exercises as demonstrated by a couple of our therapists. We're gonna take you through some exercises to reduce the pain. And lastly, we'll leave a few minutes at the end to answer any questions that you guys may have. Before we get started, I'd love to introduce our team of panelists that we have here today. They'll be joining me here on screen momentarily. First off, we have Phaeleau Cunneen. He is a hand therapist and physical therapist out of our West 44th Street office and our Park Slope office. Jamie Cotone, she is an occupational therapist from our 44th Street location, also a hand therapist. And on the back end, we'll have George Stamboulis, who will be helping out with some of the Q&A that we have behind the scenes. So again, please feel free to use that feature, and we'll get back to you guys throughout the presentation. All right, Phaeleau and Jamie, I'll let you guys take it away from here.
Thanks, Kyle. Like he said, my name is Phaeleau, and I'm a physical therapist at our 44th Street location and also at our new Park Slope location. I am the director of the hand therapy program here at Spear. And here is my colleague, Jamie.
Hi, everyone. My name's Jamie, and I'm an occupational therapist, also a hand therapist, and I work at the 44th Street location.
Great. Now, before we start, I just wanted to take a brief poll and just ask some people, how many people here have experienced pain working from home and have had pain and difficulty, say, opening jars or opening doors or writing or typing? So we're just going to take a little minute here, and we want you guys to answer this poll. All right, so we got some numbers in here, and it seems like 74% of you have pain opening jars and cans, so we're going to go over that. That's great. And then 34% typing, 26 writing. So there's a large majority of you that have experienced pain with these activities. And this is kind of the reason why we want to review and go over some of these basic joint protection principles that can help alleviate some of the pain and difficulty you might have with some of these common everyday tasks. We want to show you some tools that might help you with these activities. And now I'm sending it back to Jamie.
Right, so currently some, if not most of you, are working at home, and your home office setup may not be like it was at the office, and it's not the most ideal. Additionally, we all may be working even more hours every day since our computers and phones are readily available. I know for me, I've spent a lot of time on my phone scrolling for new recipes, keeping up with the news, or maybe even shopping. And this has been taking a toll on my thumbs and wrists.
Jamie shops a lot, that's why. So that's a great point, Jamie. Many of us are working from home these days, myself included, and your home office setup might be one of the reasons why you're in pain. A large percentage of you guys write that you have pain with typing. So I just want to give a shout out to our coworkers who did a great YouTube webinar, Kathleen and Rochelle. They did an ergonomic webinar that you can watch on our YouTube channel. Just search for Spear Physical Therapy. They provided some great information on how to properly set up a home office that is ergonomically correct, as well as some stretches and ideas on how to take breaks throughout your workday. A proper home or office ergonomic setup is vital to not getting or avoiding repetitive stress injuries. An improper setup can lead to muscle imbalances, cause pain not only in your shoulders and neck, but also in your wrists and hands. So that's why it's so important to know how to protect these joints, and we're going to show you some devices that you can use at home also.
Yes, great point, Phaeleau. All right, so I want to bring up some slides. This first one, it's going to outline some points that we are going to go over about joint protection. We want to keep these principles in mind when going through our daily activities. These principles and techniques will help alleviate our pain, protect our joints, and prevent future injuries. First, we have to listen to our bodies. We have to respect the pain. Pain is the body's way of telling us that some damage may be occurring. Signs of pain include weakness, fatigue, swelling, stiffness, and achiness. Pain lets you know that you may be doing too much and that you need to take a break. It's also important to note that pain may not always occur during the activity. It may begin after. You want to avoid tight, excessive, prolonged gripping or pinching. You want to avoid using more force than is actually needed. So choose tools that decrease the need for a tight grip or pinch and ones that fit your hand. One of the main joint protection principles I want you to remember is to use larger joints and muscle groups whenever possible. So for example, you can push an object with your legs and your entire body weight instead of pulling the object with your fingers or hands. You also want to take breaks throughout your activities. You want to give time for rest. Organize activities to reduce work efforts, and prioritize activities based on the amount of energy or the amount of pain you have. Using assistive devices and splints to help with activities will help decrease our pain and protect the joints. So my next slide I'm going to bring up is going to be a couple pictures of splints. The first splint we have here on the left, it's called the CMC arthritis splint. The CMC joint is a joint in our thumb, and this first splint helps to stabilize this joint to reduce stress and pain on this joint. The CMC joint of the thumb is one of the most common places people experience pain and one of the most common sites for arthritis. So it's very important to keep this joint stable when using your hands throughout the day. So one technique I like to use is when you're pinching something with your thumb, you want to make this OK sign. This is the most stable pinch. You don't want your little joints in your fingers to collapse. You want them to be strong and stable. So I like to look at this as like a circle OK. And the second splint we have here is the one in the middle. This is for the wrist. This helps position our wrist in a neutral, comfortable position when performing activities. For example, using the computer, carrying heavy items, working out, it helps to remind us and to be conscious of how our wrists are positioned, and it helps to keep it in a safe and neutral position. The last one we have is the ring splint. This splint helps support our finger joints, and it can be worn on any finger, and it helps with problems and other deformities such as the joints becoming stuck in a hyperextended position or instability at the knuckles. Okay, so now Phaeleau is going to come back in and we're going to go over some assistive devices that we can use at home.
Thanks, Jamie. That was great. And also, these splints that Jamie showed can also be custom made by our hand therapy team. And we're at a number of offices, and we just need a referral from your doctors. And the custom made ones are customized to your hands or fingers. They're more form fitting, and it's just another option for you. So now that we went over some splints, I also want to kind of go over some home devices that you can help use to alleviate pain. Things that, for example, you have trouble and pain opening up a jar. There's things that can help you with these. And we're not kind of promoting one item over another. There's all kinds of items for sale. So this upper left one here is a jar opener, as is the middle top one. So both of these items, what they do is you're using larger joints, so you're alleviating some of the stresses that you can put on your hand by opening the jars, just twisting. And again, what Jamie talked about, a lot of arthritis and pain is in the thumb area. The bottom left and middle one, you can see just their larger kind of foam pads here. And one of the principles is, I have one here, when you hold a pen, you're squeezing, you're putting a lot of pressure on these joints here. Some studies have shown that if you're putting, say, 10 pounds of pressure here, squeezing, that translates 5 to 8 times more pressure down into your CMC or thumb joint. So for people who really squeeze their pens tightly, a thinner pen is not the answer. So you can buy a new pen, or you can just get one of these foam things online. And what I did was I just put a pen in it. And so what happens is now my grip is wider instead of here, it's opened up a little more. So you have a much wider grip, and that will alleviate some of the joint compressive forces on your thumb joints or other joints. And that's why if you ever go to Home Depot, all the carrot peelers now are wider handles. It's to alleviate joint pressures. So that's it on the ergonomics. Oh wait, one more. I got another little handy dandy item here. So a lot of people have thumb pain, and this is a pen that puts the pressure on your index finger instead of on your thumb. So again, there's items like this online that you can kind of help for writing. So for people who really squeeze tightly, this kind of wishbone pen is very helpful, and it fits right in there. And so you don't have to push with your thumb as hard. All right, I'm gonna send it back to Jamie now.
Thanks, Phaeleau. That was great. Also, I just want to make one side note is that please put your questions in the Q&A part and not the chat section. It's on the bottom. You can see it if you scroll and roll over the bottom of the Zoom video. Okay. Thanks, Phaeleau. Those are great. I myself do tend to grip my pen too tight, so I definitely may be investing in that little foam tube. Okay, so now that we went over some joint protection principles and devices, I want to go over how we can keep our muscles strong so our joints are stable. You want to take some preventative measures. We want to maintain muscle strength and range of motion to protect joints. Balanced strength around an unstable joint can help reduce the pain and reduce further damage to that joint. Maintaining range of motion is also so important because once a joint has reduced motion, the surrounding joints, especially distal ones, smaller ones, have to make up for it. So now Phaeleau and I are going to go demonstrate some stretches and some exercises we could do to help stabilize our joints.
All right, so these are all great stretches that you can do if you're sitting at a desk too long. And earlier Jamie talked about using the large muscle groups. It's also important to stretch these. So Jamie's now going to demonstrate a really nice desk lat stretch. So the latissimus dorsi is a muscle right here. It's a large muscle, and she's just going to put her elbows on the chair and slowly roll away. Notice how her spine is really straight and she's kind of hinging from the hips. And again, I have to say, if you experience any kind of pain or you have a history of back pain, it's best to consult a physical therapist or a doctor, not to do these on your own. But this is a great, gentle kind of lat stretch. She usually exhales when she's moving her chair away and then inhales when she's returning. So you inhale here and just do it one more repetition, Jamie, and then exhale here. Spine in a neutral position.
Awesome. Okay, the next one we want to go over is the pec stretch. So this one's really good to help with posture. And as you can see, Phaeleau's demonstrating, he found a wall. You can either do this in a doorway, side of a wall, or in a corner of a room. This is going to help open up our chest. It's going to stretch these pec muscles out so we can bring our shoulders back and down. Perfect, Phaeleau. Great form. How's it feel?
Thank you. It feels good. And a common mistake with this one is people kind of bring their head forward. So again, kind of keep your spine in a neutral position, your head over your spine, and then lean forward.
Awesome.
All right, now we're switching back to Jamie, and she's going to demonstrate another great office stretch. It's a tricep stretch. So that's the muscle that extends your arm and it attaches from here to here. And you can see she's slowly stretching it back. And stretches, you should be holding them 20, 30 seconds. If it hurts, don't stretch so hard. Just ease into these stretches. It's best to be warmed up. So if you're doing office stretches, go really lightly into them.
That's good. Okay, the last stretch we want to show is for your wrists and your hands. So this first one, we're going to stretch the wrist extensor mechanism. We're going to bring the wrist down. So this helps if you're at the computer all day, you're typing and you're writing, it's really going to be tight in here and tight in these tendons. So you kind of want to open up this area. So what Phaeleau is doing is his elbow straight. He's pulling it towards the floor to help stretch out and alleviate some pain in his forearm and his wrist.
One thing too is make sure that your shoulder is down. A lot of people hike up their shoulder. Keep your shoulder down while you're doing that.
Perfect. And then the other one is the flexions that we're going to stretch the flexors. This is when we're doing a lot of gripping, also typing. And this is the same position. Keep your elbow straight and you're just pulling your hand towards your body. Perfect. Okay, the last one we want to show is just a way we can strengthen our joint, our wrists, and our tiny joints around our hand.
So you can see she's holding, and again, start with a 1 or 2 pound weight. You can go up to 3 or 4 pounds, and you can think about your wrist column as a core. So you want to strengthen all sides. You want to strengthen this side, this side, this side, and that side. So she's going to be doing this resistive exercise back and forth about 10 times. And then she's switching directions and going up and down that way. If you don't have weights, you can do these with TheraBands as well, or some household items, you know, like a can of Campbell's soup.
Yeah, I found a lot of people I work with, they don't have like 1 or 2 pound weights, and they mostly use either heavy water bottles or like cans of soups.
Where's Coda?
That Coda's my dog. She is taking her afternoon nap. Maybe she'll pop in later. All right, so those were all the exercises and stretches we wanted to go over, just a brief overview.
So we want to just show you some basic joint protection, you know, principles. And again, if you guys have any questions, you can make appointments with us to get a, you know, personalized consultation. But we want to, you know, reference that scheduling a time to come into our office or doing a telehealth session would be probably the most beneficial thing. What we showed you was just a very brief overview of the joint protection principles. So we have a great hand team at Spear, and just not myself and Jamie, there are others as well. So please come in if you want to. Also, if you want kind of a referral to a doctor, we have great relationships with some of the best hand doctor orthopedists in the city, and we'd be happy to recommend a hand doctor for you.
Also, like Phaeleau mentioned before, most of the splints that we showed you today, they aren't custom made for you. But if you come into the clinics with a referral, we can make them specifically for you and for your hand. It's going to be more comfortable when you're wearing them throughout the day or at night. All right, so now we're going to bring Kyle back in and we can begin our Q&A portion.
All right, thanks guys. Just a reminder to everybody else who's viewing here, the Q&A feature at the bottom of the Zoom page is the best way to get a hold of us. I've had a couple of people mention being able to see all the presenters. If you want to be able to see all of us, please select gallery view in the top right section of Zoom. And for those of you on YouTube, please use the comments feature to be able to reach out to us. All right, so Jamie and Phaeleau, a couple questions that came through here. You guys mentioned a couple different items for people to use for the pens and the silverware and things like that. Where do people order those and what can they search for, I guess, on Amazon or different outlets?
You know, so this one, that it's 3 size of foam tubing, but you know, you can just Google foam tubing or email me and I can send you the link, but it's just foam tubing for utensils. So, because you can use this for putting pens in, or you can put forks and knives in, anything kind of. I've had patients who are dentists and I recommended this because they have those same kind of utensils and they're getting some thumb pain. So you can use kind of anything, and 3 different diameters to fit any kind of household item. I had another patient who was a painter who uses these because the paint brushes were so narrow, and so she likes these as well.
Yeah, I know. I just went on Amazon or Google and I just Googled like built up grip for pen, and so many things come up.
Got it. And if we could get the slide back up one more time with the different pictures, give us a second here. We'll pull that up with the different devices on it. Just to go over those one more time. A couple of people were asking about them. Jamie or Phaeleau, could you guys go through these guys one more time, which each one is? There's a couple different questions on which ones things are.
Yeah, sure. So the top left, the gray and white one, that's really to use to open jars. So what you do is you stick that big part, that triangle part on the top of the jar and you turn it. Instead of using your fingers to grip, you're using bigger joints to open it. Same thing with the middle and the middle guy. It's kind of for smaller jars or even like bottle tops you put that on top and you twist it and it gives it more of a grip. And then what else? We went over the built up grips, and then the top right. So that is the big blue thing you see. It's Dicem, and it prevents the plate from spinning or sliding, so you don't have to hold it and grip it while eating. And that's an ergonomic keyboard. I know a lot of people have been using these and they're great. It really helps just keep the wrist and forearm and fingers in an ergonomically correct position, because all of us are at our computers all day. I'm sure everyone can use these.
Awesome.
So I just Googled foam tubing grips on Amazon, and the first thing that came up was the 6-pack of foam grip tubing, which are these basically. And
Perfect.
Awesome. One of the questions that we had come through for somebody, if somebody has wrist arthritis and is wearing a splint, should they wear it as much as possible, or should they wear it during certain times? What do you guys suggest?
So if you have wrist arthritis, you should be moving your wrist as well. You don't want to totally immobilize any arthritic joint. Sometimes I'll say motion is lotion. And what happens is a stiff joint needs motion to get joint nutrition. There's fluids in the joint that help with movement. So you want to move it. You want to do pain-free range of motion, maybe not as much resistive exercises, but you don't want to immobilize an arthritic joint, whether it's a shoulder or a hip or a wrist. You want to get some movement and blood flow going through that joint.
Awesome, thanks, Phaeleau. Couple questions about tendons popping. What is it when you feel a popping or a tendon in your hand when you do different stuff? Is that cause for concern?
Well, if there's any pain with any motion or tendon popping you're feeling, I would recommend reaching out to either a doctor or one of us, but it's not a huge cause for concern. Sometimes our joints, we just kind of crack and pop, and that's just part of everyday life. I know my joints, I crack and I pop, but as long as there's no pain, severe stabbing pain with it, I think it's fine.
Excellent, thanks, Jamie. Let's see. People who have trigger finger, had a couple of trigger finger questions come through. What do you guys suggest for at-home remedies or any kind of splinting for those?
I also want to give a shout out to Elaine. Elaine is another hand therapist at our 57th Street office, and she and I did a webinar that included trigger finger, and so it's also on the YouTube Spear channel. But a lot of times for trigger finger with a doctor referral, we can make a kind of a customized splint. So it's not immobilizing your whole hand. It's just, say it's your index finger. We can immobilize this. We can immobilize the thumb. So most doctors and therapists recommend a night resting splint. A lot of times people will clench at night, and in the morning they'll be triggering. So during the day you can't wear it because you have to use it, but to stretch out kind of the tendons at night. So we can make a night resting splint for you.
Awesome. 2 or 3 different questions kind of alluding to the same thing, so I'll try to consolidate here. Fingers and hands cramping while writing or texting, and the hand kind of staying in that crimped kind of position. Cause for concern, and what can be done about it at home?
So main thing there is you really want to take breaks. You don't want to be, typing and writing and having that prolonged grip for an extended period of time. And then stretching out the hand, maybe using some heat to warm up those joints, get everything moving, get the blood flowing. What do you think, Phaeleau?
I believe the same thing. Yeah. I mean, a lot of times we recommend, come in for a consult so we can get a look at it in person. I think our expertise would be better served seeing it in person. It could be an arthritic joint, it could be triggering. A lot of times with a trigger finger, they'll have painful kind of nodules here that we'd have to palpate and we can see it, or it could be from arthritis. So, but I agree with Jamie on that one, yes.
Excellent. Let me scroll through here. A couple of questions, some of the exercises you guys demonstrate. So last to go through for the lat stretch, I think Jamie, you demonstrated that one. People don't have a rolling chair at home. What's the best way they could do that?
Oh, so what you can also do is you can kneel in front of like your couch or the chair on the floor. If it's like soft, put like a towel under your knees, or if you have carpet, that's fine. And I can try to demonstrate it from here. So you're putting your elbows on the chair and you're kind of sitting back onto your heels, and then you'll feel that stretch, if that makes sense.
Perfect. And then there was another question in terms of the hand flexion and extension stretches. Should it be all 5 fingers? Should it be just the 4 and the thumb is out to the side? What's the best form for that?
So for this one, stretching, I'm usually doing all fingers. Sometimes I do like to, you know, just do two and then do these other two, kind of differentiate. But I usually, just to keep it simple, I do all the fingers. I'm not including the thumb now. You can stretch out the thumb. I wouldn't hyperextend the thumb, kind of keeping it, just stretching it to neutral. But I'm usually not including the thumb on those stretches.
Excellent. Are these stretches okay for somebody to do who has an injury of, let's say, the shoulder or of the elbow?
Good question.
Yeah, go ahead, Jamie.
So definitely what we mentioned before is depending on where your injury is, definitely consult with someone, but keeping your shoulder and your elbow in a neutral position when working on the wrist is best for all joints.
Excellent. Got another one here. Well, this is a good one. I've experienced this with myself, actually. Resting the elbows on the desk and having pain as a result of that. What do we do for that?
So there's really nothing here protecting. It's just bone here. So I usually recommend not doing it. You can just take a folded up towel to rest your elbows. You do have a bursa or a fluid filled sac here. And if you really irritate it, you can get a bursitis there, which is just an inflammation of the bursa. So resting a towel, there is something called a heel bow, HEELBO, which is basically a sleeve you put on your elbow, and it has a really nice gel. So I recommend this for people who have fractured. This is the olecranon. They fractured their olecranon. So you can get a pad and then you can wear it over a sleeve. People won't even notice it. But if you do have pain with resting that bone on a hard surface, I recommend just cushioning the hard surface somehow.
Awesome. Thanks, Phaeleau. Let's see. I had a couple questions about the balls that people use in their hands to kind of do some of the massaging. Is that something you should do, or any of those like little devices that people use for you know, fidget spinners and things like that? Are those useful at all for hand therapy?
So you mentioned like little balls for massaging. I know, I mean, we use them in the clinic. They're these little rainbow, they're cat toys, basically. Yeah, you can go grab one. We get them at like PetSmart, Petco, anywhere. You can get them on Amazon. If you just type in like ball cat toy, they're these tiny little balls that we use to, you put them on the surface you're at, and you kind of roll out your whole palm to get all those little muscles and all those joints opened up in the hand. Because sometimes when we massage one hand, we're angering the other. So this just helps save the other hand. I think Phaelau's going to grab one of those little rainbow toys.
I think Phaelau's going to go grab one. So Jamie, I'll give you a question in the meantime. Yeah. Someone asked about recommendations for stretches or exercise for pianists specifically.
Yeah, so we actually do get a lot of people who play piano, and depending on what it is, just opening up, because it's a lot of repetitive use of your extensors and your flexors. So just opening up your hand, doing those stretches that we recommended. And then there's also other stretches that we can discuss if you reach out.
All right.
What did you find?
So these are kind of like cat toys, but if everyone's ever foam rolled their legs and stuff, it's the same thing. And it works really, especially for people who have pain in this kind of area right in here. So you don't want to dig your other thumb in there. So you can kind of just roll that area there. So you can just put it on the table. I don't know if you can see that. I'm just massaging that area. And that usually gives great relief to someone who has some thumb pain. But you can use that all the way up to here. You can do it on your forearm. You can also get these larger ones that work really well, even on your flexors as well, which get very tight for people who are typing a lot. And again, you can just put it on the table and roll it out. Sorry. See that angle, rolling it out like that. Can you guys see that?
Yeah.
Awesome. A lot of the stretches that you guys showed us are stretches are meant to, you know, get some flexibility work into the wrists and forearms. What about strengthening? What kind of strengthening things can people do at home?
So like we showed with the weight, those are really good exercises for the wrist, and one for the fingers. This is just a hair tie I have, and I'm just opening up my fingers And this will help strengthen the extensors in the fingers on the back of the hand.
You can also use a rubber band, like the postal service bands are a nice kind of resistance. So you can put one, then build it up to two. If you get really strong, you can use a kale band, and then the broccoli bands were probably the strongest rubber bands. And that's like an advanced black belt finger extension exercise.
And then also, just like any grip, stress ball, grip strengthening type of ball that you can get anywhere, that'll really help with grip strength and finger strength.
We've had a couple questions come in about elbow pain, specifically about tennis elbow. For somebody who's experiencing pain, first off, can you guys explain what tennis elbow is a little bit, and then explain what are some things that someone do to alleviate the pain and prevent it from happening?
So tennis elbow. So first of all, you have two kind of muscle insertions here, and this middle one is the one that is your flexors, and your flexors are much stronger than your extensors. So the extensors are the one that open up like that, and that's the tennis elbow. These are kind of a weaker muscle, and so we overuse it often. If it's a true tennis elbow, I'd say, you know, maybe we got to look at your form. And but there is something called a counterforce brace or tennis elbow brace that a lot of people use, and what that does is it takes the strain off the insertion, the musculotendinous insertion here. So all your extensors, all of these muscles here insert right on that bone. So you take it about 1.5 inches below, and you can get that counterforce brace. A lot of times I also like the over-the-counter wrist braces, because what that does is it keeps your wrist in a slightly extended position, so all of these guys are on slack. So a lot of times I'll say wear that at night. So wear a wrist brace at night, then wear the counterforce brace during the day or with activity. And then go see a therapist.
Awesome. Someone asked if the stretches that we demonstrate today, are they okay to do if you have an injury, like a trigger finger or something to that sort?
Yes, I would. If you have a trigger finger, this kind of stretch is good to do. Yes.
Definitely.
Awesome. For anybody else who's trying to add into the Q&A section, please continue to do so at the bottom here. Click the Q&A feature. We're getting some in. I'm trying to consolidate as best we can here. And same thing on YouTube into the comment section. People have been talking about doing increased writing now that they've been home and doing work from home. What kind of tips do you have for writing?
So for writing, as we mentioned, take breaks, don't overuse and do it all the time. What Phaelau's holding up, you want to increase the grip of your pen so you're not gripping as hard and you're not using more strength than you need to. A smaller pen is not going to be good on the joints. It's just going to cause some pain. So getting either a larger pen or the built up grip around the pen, that'll really help.
Also, like if you can see kind of when you're pushing down, if you can see the whites here, you're probably pressing way too hard. And I know a lot of people, like my daughter, she presses so hard. And so she would need one of the buildups that Jamie was talking about, but also just try holding your hand a little lighter, just not that super grip, just lightening it up or changing pens. But the wider grip ones will alleviate some of that joint pain.
Yep.
We had 2 questions come in regarding nerve pain, so numbness in the fingers. Is there anything that we can do for that?
Yes, definitely. With nerves, it's you have to figure out where it's coming from, and your nerves, they start from your neck and come all the way down your arm, cross over your shoulder, your elbow, and into your fingers. So it could be posture related. It could be getting caught in the elbow or the hand. So there's ways that we have to go about it, but definitely just trying to keep that good posture, keeping your shoulders back and down. I was not doing it just then. I just caught myself. It feels like you're working your muscles because you are. I mean, you have to keep reminding yourself to keep your posture good and keep your shoulders back. And I saw, Phaelau, you fixed your posture right when I said that.
Yeah, automatically.
But yeah, definitely we can help with some nerve pain, stretching and massaging. That'll help. Sometimes the nerve is caught and sometimes the muscles are inflamed. So sometimes the massaging, icing helps. There's a lot of things that could help with nerve.
Could you guys dig a little deeper? One person was asking about like posture, neck and shoulder stuff, and you just mentioned that, Jamie. So can you dig a little deeper into like some things to do posture wise?
Yes. So one was the pec stretch that we did before. You want to open up your pec muscles so then you can strengthen your back muscles, your shoulder muscles, your shoulder blade. One of the exercises you could do, we'll see Phaelau's demonstrating poor posture. He's got rounded back. Good. You want to pull it back. Use your core, use your back muscles and pull everything into alignment. He's also doing a chin tuck exercise, which is what I was going to mention. That fun little double chin that we can create on ourselves. That's what we're going to do. We'll pull back. You'll feel like a stretch in the back of your neck. Good. Great form, Phaelau.
Thank you. Thank you, Jamie.
So when you're doing that chin tuck, what are you feeling and what are you trying to do?
So most of us, when we're typing or texting, our shoulders are forward, our neck is down. So what happens is you're working all of these muscles in the back of your neck and here. So these muscles are getting long and weak, and the muscles here, like your pec, is getting strong and tight. It's a larger muscle. So part of proper posture ergonomics is restoring muscle balance. But when I'm doing a chin tuck, is your head weighs like 8 to 10 pounds, and it has to be balanced on your spine. So if your head's forward, all of these muscles are working hard. So a chin tuck is just restoring kind of proper posture balance of your skull or your head over your spine. So it's something good to do when you're on your computer or laptop. Just do chin tucks every hour, and it'll remind you like, whoa, my head is really forward. One thing I like to do too is I call it like the wall test. I just come against a wall and I put my whole spine and my head against the wall. And now I'm in an upright position. Most of us are in this position, and then we do this and it feels weird, but now I'm in an upright position. And that's the position you should be at when you're at the computer. So sometimes it's good just to lean against the wall, put your whole spine and head flat, and then you're check to do.
Generally speaking, Phaelau and Jamie, how long should we hold these stretches for?
I think in the beginning, ease into it. You can hold it for 5 seconds, but for the chin tucks, I mean, ideally you want to be staying in that position. So I'm doing a chin tuck, but then I want to hold that position for a long time. But 5 to 10 seconds is a good kind of starting point. Just to, you're almost ranging your cervical spine into extension more, because we're always in such a flexed forward head position.
Question here regarding arthritis. Are there any early signs of arthritis, specifically in the wrist, and how do we prevent it from occurring?
So usually arthritis is stiffness, especially in the morning, but then when I get going more, it loosens up, and that can be your neck, your back. I'm very stiff, and then after a hot shower, I'm walking a little bit, I loosen it up. And so it's tightness. So one thing you can do is joint protection principles. If you think you have arthritis, an x-ray will confirm that from an orthopedic doctor, but then you don't want the arthritis to get worse. So say if you have arthritis in your wrist, I wouldn't be doing push-ups. I would do push-ups in a neutral position, but not that way, because that puts a lot of stress. So I'd start protecting my joints. Maybe boxing would be another thing I wouldn't be doing a lot of if I had some arthritis in my wrist. Same thing if you have arthritis in your back or your neck, you want to kind of protect the joints from stress.
Awesome. What about the difference between carpal tunnel and arthritis?
So carpal tunnel is more of a compression on the median nerve that runs right here through your hand. So a lot of repetitive stress, a lot of repetitive activities, and just a lot of gripping may anger this area, and then it'll cause more of those symptoms, numbness, pain, where arthritis is more bone related, wear and tear, and carpal tunnel is like a nerve irritation.
Excellent. Couple of questions about sleep, so I'll go into that for a second. Is it a bad idea to sleep on your side for shoulder pain, or if you have a history of shoulder pain? / what are the best sleeping positions to be in terms of your upper extremities?
If it's, say, your left shoulder, I probably wouldn't try to sleep on that left side, because a lot of times what people do is when they're sleeping, they're also scrunching up. So you're putting your shoulder in kind of an impinged position and then putting weight on it. So especially if you're waking up with pain in your shoulder and you're sleeping on that side, I would try to avoid doing that. You can also put a large pillow underneath to kind of rest the joint, and then it's harder to roll over on that side when you have something underneath it. Because a lot of people will start off lying down on their back and then roll over to that side. If you do tend to roll over on the side, try to lower your shoulder down so you're not scrunching it so much. I do find a lot of people use too many pillows too, 2, 3 pillows in their head, and that's just keeping their head in a flex position as well.
Yeah, the best position to sleep is on your back, because everything's in alignment and everything's neutral. But I mean, I'm guilty. It's hard to just stay on your back. But definitely putting a pillow underneath your arm, that was a good point. That's really good to help with the shoulder.
In terms of wrist, if you wake up with your wrist kind of in that flex position or that bent position like so, but there's not necessarily pain, is preemptive splinting, night splinting, Phaeleau, you mentioned that, is that something you should do preemptively or only wait until later on?
A lot of us do sleep in that kind of comfortable position, this way, that way, scrunched up. I mean, if there's no numbness or pain, I don't think you would need to splint. You could, try getting a $20 over-the-counter CVS type splint to see if it feels better. But that's probably something you've been doing for years, your natural sleeping position. So if there's no issues, pain, I wouldn't change anything.
Agreed.
If there is, if you do have numbness, tingling, it's a common kind of cause of the carpal tunnel, then I would wear night splints.
Yeah.
We spoke a little bit about arthritis. I have an arthritis question here. Does it ever go away, or do we have to deal with it?
So with arthritis, there is no cure, but there's a way to protect the joints, to alleviate pain, and ways to modify how we can go about our days so we don't have to experience this pain.
Awesome. Phaeleau, we have a request for you to demonstrate the push-ups one more time to see the wrist hand position.
Oh, which one? The push-up?
Yes.
Okay. You got it. They do, and again, you could do push-ups on your knees to start, but I'm gonna come here. So normally you're doing push-ups like this. There, you can see me, right?
Yep.
So you just go like this. So from this position, it'd be like this. You pull it like this. And then you're doing the push-up. So again, from the side view, I'm here, my wrists are straight. And you're coming down. So
And you can also
great position.
You can also use a dumbbell, right? You can hold it.
Yes.
Some people like that.
If you guys want.
Jamie, while Phaeleau is getting situated there again, any advice for a computer mouse and how to deal with that? Or I've heard a couple people, and at least when I practice, have like the neutral grip computer mouse, which is kind of vertical like this. What are your thoughts?
So I was actually just discussing this today. I find that the trackpad on a laptop is not good for our wrists. So I have just a regular mouse, an external one, so I can have my elbow, wrist, and hand in a neutral position. But I know some people, they do like the ergonomically correct mouses. I think that's how you say it, not mouse. But there's one that you said is vertical that you can hold like this, so it's less stress on the fingers. But then there's also one where you're not using, there's like a ball that you can roll with your fingers instead of using your wrist to move it back and forth. And I don't have a preference over which one. I think it's more personal of which one you prefer.
Awesome, thanks. Just to remind everybody, we got a couple more minutes here. We'll get a couple last minute questions in. We will print all these out. I'm sorry, print them all out. We will type all these questions up and give a summary sheet to everybody who's in attendance today. So if anybody has any questions or missed anything, we'll take care of that. And we'll also have this recorded on our YouTube channel as well. So in case anybody misses anything, you can always go back in there. Let's see, a couple different things. I was just demonstrating more push-ups with the dumbbells, showing off. What are some other laptop faults that people have sometimes, because it's not the best setup and it's what people are using now at home instead of being at their desk? What are some other things that people can use at home to help with that?
So you can get either a wrist pad for your keyboard, or you can just take a towel and like roll it up into like a long tube. So you can rest your wrist and it's in that neutral position instead of like this when you're typing. I have this little platform. I can try to show you this platform where I place my computer on it. And this helps keep your computer eye level so you're not looking down and you're not straining your neck the entire time. I know people, if they don't want to buy these, you can just stack some textbooks and raise the level of the computer screen.
Excellent. All right. Right here. Scrolling through. We'll get to one last question right here. Someone, Phaeleau, you had mentioned about too many pillows when sleeping. What's the best in terms of sleeping on the back? Is it better to sleep with lots of pillows, no pillows, anything like that?
Ideally, one thin pillow or no pillow. So again, I'm going to go back to the same wall position here. Your spine, you should be like this. So if your head's kind of like this, which a lot of people have if they have 2-3 pillows, that's not a natural position for your head. But, because during waking hours, we're in a forward head position, and then we tend to like to be in that position. So I myself have one very kind of old down pillow that forms around my head. Joe Costello, another therapist, used to like doing the bow tie kind of position. So we take a pillow and almost tie a thin kind of rope around it so it's a bow tie, so it forms around your head more, supporting on the side. So you can just try that with a regular pillow as well.
All right. Well, Jamie and Phaeleau, thanks for getting to a lot of those questions here. For any of the attendees listening, if we didn't get to your question, we apologize. Just to make sure we get out of here on time and make sure we take care of you guys. We will be reaching out, like I said, with a summary list of questions and hope to answer as many as we can on that back end. So if we didn't get to you live today, we'll get to you on the back end and promise we get all the information out to you. So we hope you guys got some good information and today was valuable and you learned how to properly form some new exercises and progress them and some new stretches for wrist pain. I know I did. So if we can answer your question, like I said, please feel free to reach out to us directly afterwards. We're going to put our contact info up here in a couple of seconds, and we will be following up with a handout shortly. So to reach Phaeleau or Jamie, their information is on here. We'll leave the slide up for a couple of seconds so everybody can grab their information. Phaeleau is the director of our hand therapy program here at Spear. He treats in the Midtown 44th Street office as well as in Brooklyn over in Park Slope. And Jamie is an occupational therapist. She also treats out of our Midtown 44th Street location. And by the way, all of us are available on Spear Live, our telehealth platform. So if you find it tough to get into the city or travel or wherever, we have those resources for you as well. Myself, I'm the director and I'm a physical therapist up at our Westchester Pleasantville office up in the suburbs for anybody who may be quarantining up in that direction. And George, who's been helping answer a lot of the questions everybody's been having on the back end. He is also at our 44th Street office, and any one of us will be happy to assist you and get you to where you need to go. And we will personally make sure that you get the therapist and the treatment that you guys need. So thank you again for joining us. As our orthopedic outpatient physical therapy practice, we treat an array of conditions from head to toe, not just hands and upper body. We're here for in-person visits as well as telehealth sessions. If you feel like you could benefit from any individualized guidance from our therapists, please don't hesitate to reach out to any one of us, as you saw earlier. We'll, like I said, personally coordinate to make sure you get set up with one of the members of our team. Thank you all so much for spending the afternoon with us. We hope you enjoyed the webinar, and we wish you all the best. So be well, everybody. Thank you.